We're still rocking here at Cosmetic Surgery Forum in Nashville, and Dr. Manjula Jegasothy from Miami is with us. She spoke here about cosmeceuticals, about some laser tips, as well as some buttock lifting procedures that she's doing in the office. So talk to us about some of your pearls.
This year was a great year for me to find new uses for some of the lasers that I already have in my office. And so among the things I thought that were particularly useful is what I'm doing is dialing things down a lot. I think, less is more now with lasers, and people are starting to realize that. And I think especially as dermatologists and sort of the experts on skin biology and histology, we can really target the laser to the right place, but also the right setting to get the best results. For example, for things like melasma and bad inflammatory photo damage and things that we couldn't do well with before.
You're using this term laser sort of all-encompassing, but I know you spoke a little bit about using all therapy in new directions. So let's talk a little bit about that.
So every time we have an interview, Dr. Cohen loves to talk about my laser butt lifts, so we'll talk about that today. In the past, we always talked about doing them on people who have near perfect bodies, people who are in very good shape and all that. And I think this year I expanded that patient model, and I feel much more comfortable doing these kinds of lifts now with different lasers on people who are not so perfect, but who really can improve from that as well. It doesn't just have to be a very small butt. It can be all sizes.
Honestly, from a perspective of people really anticipating what their efficacy is going to be, like, how do you counsel them on this?
It's actually becoming easier as I do more people of varying body mass indexes. You can tell people who are actually thinner and lower body mass indexes that they're going to get a less % improvement because they're already almost there, right? So you can tell people in the 23 to 26 range that they can get about a 20% improvement, maybe with 2 to 3 treatments, 2 treatments. And then, if they're a little bit heavier, you can give them a 30 to 40% improvement, and so on and so forth. The bigger you are, the better the improvement.
And in terms of overall devices that you're using, is this primarily all therapy, and then talk about sort of the durability of these types of improvements?
It's a combination of all therapy for lifting, and then I'm liking to do a lot of Vanquish for particularly hard to reach places like the back and the upper buttock and those places for actual debulking, and then we'll refine and lift with the Altera. But I'm pretty, I'm looking forward to some of the new technologies that are going to be coming out for other types of body contouring in the future, like the Citrellis laser, which I think I can use on the body as well as the face, and definitely the new Xiaflex injectable contouring agent for the cellulite.
Thank you for joining us for DermTube meeting coverage from Cosmetic Surgery Forum.